We often talk about rising demand on healthcare as one of the key challenges we have here at Ashford St Peter's. And I think sometimes when we're describing that, we're often talking about it with regard to the impact on our emergency care pathway and our accident and emergency department. And of course, that's absolutely right. It does present a real challenge. But there are other teams in the hospital who are really feeling the brunt of absolutely huge increases in demand. And I thought it was important that we maybe meet one of those teams and understand what lies behind that increase in demand and how they've risen to that challenge. So this afternoon I've come to the endoscopy suite here at St Peter's to talk to some of our clinicians and some of our nurses about how they've operated as a team to meet the challenge of what is quite unprecedented demand on their service. Over the last 12 to 6 months, we've seen a really big increase in demand for endoscopy services. What do you think lies behind that?
I think the primary reason behind the increased capacity is the public awareness, which has been raised through various campaigns. The most recent campaign was about cancer of the upper GI tract with the swallowing problems and various other things. The other thing that might have also affected is the service that we provide out of this unit is very good, and it might be quite possible that the CCGs and the GPs that we are serving might be quite happy with our service and are referring more and more patients.
So the patient sadly is experiencing some of those worrying or uncomfortable symptoms. They go to their GP, and the GP would refer them to you and your colleagues here at the unit for either an upper GI scope camera or bowel
a colonoscopy or a flexible signaloscopy.
Okay.
Yes.
And what most commonly do you find?
In most instances, they would have, a lot of them would have normal results, okay? But if unfortunately we found any abnormality, it would be in the form of a cancer change, okay, or an ulcer in the bowel. If we have any suspicion of a cancer, we would immediately proceed to undertake a CT scan of the body to see that there hasn't been any spread of the cancer elsewhere. We have got a very good working relationship with the radiologists so that we can offer most patients a CT scan on the same day.
Just talk me through how the team have responded to the massive increase in demand on your service.
With a set number of people, with a set infrastructure, we just had to increase our efficiency really. So the manner in which we've done this is that we've increased the number of sessions we do in a day.
Okay, so how many sessions do you now run a day?
In endoscopy we have about 3 sessions a day, and that's Monday to Friday.
Okay.
We also provide a weekend service, and for us the weekend endoscopy is no different, no shorter than it is on a weekday. Okay. And we do 2 sessions on a Saturday, 2 sessions on a Sunday, running to full capacity, which means running both rooms. And on some occasions, when we really feel the pressure, we then even encroach upon into theatres. We use theatre number 7, and we also use a day theatre as well.
You're now full 7-day working. How have you persuaded the team to really come behind that as a principle and make it work?
We struggle to start with when we changed our service from working 5 days a week, 8 to 6, Monday to Friday, to make it 7 days a week. So those people who's got family, we try to adjust the hours as well as much as we can, so it doesn't have problems with our service as well.
Well, I've really enjoyed spending some time up here on the endoscopy unit. Yeah. I'm so impressed. I'm always impressed when I come and see you guys. I'm so impressed to see how the team have worked together to rise to the challenge that they've described, and really to hear what a really big impact and a big difference that makes to our patients. So thanks very much to the team. So next time I'm hoping to come and meet another clinical team, maybe it's you and your team, to hear about your challenges and how you're working together to respond. So I look forward to that, and I'll be seeing you all soon.